Hi, my name is Jim, and I'm with Luremark Student Insurance. We partnered with City College of San Francisco to provide its international students with health insurance coverage while they are attending the college. On behalf of our team, I'd like to welcome you to the United States. We're thrilled you're here, and we're honored to be able to support you on your academic journey. Luremark has supported international students for over 30 years, so we understand your unique needs and work with schools to design and manage intelligent, ethical, and affordable insurance programs that support their students' well-being and protect them from financial hardship. During this short video today, I'm going to talk with you about the medical insurance plan that's provided to you by your college and share some important information about the US healthcare system that will help you understand why you need this insurance plan in the first place. We'll talk about the steps you need to take to enroll into the plan, what the insurance plan benefits include, and how to use the benefits of this plan, and how to access healthcare. Lastly, we'll talk about other important free services that are provided through our program to support your overall well-being. First, let's talk about the US healthcare system. So here in the United States, you'll have access to excellent healthcare. However, the cost of that healthcare can be very, very expensive. On top of that, it's the individual person's responsibility to pay for their own healthcare costs, which can be very, very high. On average, people in the United States spend nearly double on healthcare versus most other countries. This is not to scare you, but just to make you aware of why the insurance plan is provided to you in the first place, and why the information I'm sharing with you today is important. So you may have some costs if you need to obtain healthcare, but we have insurance in the US so that most of those costs are paid by your insurance and very little ends up being your responsibility. Our goal at Luremark is to make sure that if something does happen that requires medical care, that you have the tools to access the care you need and are not caused financial hardship by those costs. We know you've worked really hard to get into your school here in the United States, and we don't want you to have to choose between paying for unexpected medical bills and paying for your education. So with that, I'm going to navigate to our website and show you around the plan. We'll start on our homepage, www.luremark.com. To start, select your school in the box where it says search for your school, and start by typing in your school name. If you're in an academic credit earning program, you'll choose the first option, Credit Academic Program. If you're part of the Intensive English Program or IEP, you'll choose the second option. And that will take you to our custom page that's set up for City College of San Francisco. The first thing you'll notice at the top of the page is our contact information. If you have any questions at all regarding enrolling into the plan, accessing healthcare, understanding what your plan covers, please reach out to our team. You can reach us via phone, via email, or via chat using the feature down here at the bottom right of the page during regular business hours, which for Luremark are 8 a.m. to 5 p.m. Central Standard Time. Here in California, that's 6 a.m. to 3 p.m. Pacific Time. But please remember, we're here to help with any questions or concerns that you might have. The first thing that you'll need to do is enroll into the plan. To do that, click on the shopping cart that says Purchase Student Insurance. You'll then enter your student ID number. If your student ID number includes any letters, such as a W or A, or symbols, such as an @ symbol, you can simply replace those letters or that symbol with the number 0. The ID number that you enter will need to be 9 digits. After you enter your ID number, click Next to proceed. I've pre-filled this for you, but on the next page, you'll enter your name, date of birth, gender, visa type, address, email address, and optionally your telephone number. For your address here in the US, enter the address that you expect to live at here in the United States, If it changes, that's okay. You can always update this with us later. Your email address is very important. This is where we'll send your confirmation once you complete the enrollment, and any important information regarding the plan will be sent to this email once you use the plan. After you've entered your personal information, click Next to proceed. You'll need to do this each semester. So you'll choose the start date, which will be the start date listed for the current semester's insurance term, and the end date, which is the end date for the current semester's insurance term. Click Next to proceed. Confirm that all the information is accurate, and then click Pay with Card. Re-enter your email, and at this point you can enter your credit card or debit card information. Click Pay to complete the process. Once the payment is accepted, your confirmation page will appear on the screen, and you'll also receive a confirmation email sent to the email that you've provided to us. Once you're enrolled into the plan, you can create your member account. To access your member account, click on Print Your ID Card or Student Login. Either button will take you to the same place. Once you click on either of those buttons, if it's your first time visiting the page, click the toggle to highlight I need to create a login. You'll enter your date of birth, and you'll enter your student ID number just as you did when you enrolled into the plan. Once you're logged in, you can access important information that you can utilize to use the insurance plan. The first item that you'll want to access is your insurance ID card. This is just a test account, so you don't see it here, but when you're in your own account, you'll be able to download your insurance ID card right from this icon here. You can also download your insurance ID card using this button, Online ID Card. This is an important document that you should save on your phone or print and keep with you at all times. If you do need to get to access medical care, the doctor, hospital, or pharmacy will ask for your insurance ID card, so you want to make sure that you keep that document with you at all times. Using your member account, you could also access your claims. This means if you use your insurance plan, any bills that are processed by your insurance plan will appear here in your account. Next, let's talk about where you can find the information about what your plan covers. To view the highlights and high-level summary of what your plan covers, you can click on Plan Summary. To view all the details of what your plan covers and what your plan does not cover, you can click on Plan Brochure. We'll quickly review the plan summary. In general, the insurance plan is designed to protect you from costs that you would incur for unexpected accidents or sicknesses that occur while you're covered under the plan. As I mentioned earlier, there are some expenses that are your responsibility, but the plan should pay the majority of covered medical expenses. Some of the costs that are your responsibility include the annual deductible, which is $100. This means you're responsible for the first $100 in charges that you incur under the plan. You're also responsible for a copay, which is a set amount for certain services, like a doctor office visit, hospital stay, or emergency room visit. You'll notice here that we list terminology in-network and out-of-network. Under your plan, we provide access to a network of doctors and medical providers that are part of the Aetna network. You can visit any medical provider that you wish. However, if they're not part of the Aetna network, you'd also be responsible for 20% of any charges, while the plan would only pay 80%. So while you can visit any medical provider that you wish, it's more cost effective for you to visit a provider that's in that Aetna network. Next, we'll talk about where you can find those medical providers. To find medical providers that are part of the Aetna network that your plan uses, click Search for a Doctor. Then click Find an Aetna Provider. From here, you can enter your city or zip code. This works anywhere in the United States, so if you're outside of San Francisco or California and need medical care, you can always come here and find a provider that's near you. So enter your zip code or city, click Search, choose Primary PPO Network, and continue. From here, there's a variety of ways that you can search. You can find specific doctors with specific specialties, like a cardiologist, dermatologist, or OBGYN. You can find hospitals or emergency rooms. You can find urgent care facilities or walk-in clinics, as well as mental health providers, which your plan provides coverage for. We'll click on urgent care for this example. And once you do that, you'll be provided with a list of providers based on distance from your zip code or city. You can also click on Map View to find providers that are near your location. This is just a few of the providers that are in the San Francisco area. Next, let's talk about where you can receive healthcare. So we've talked about where you can find providers that are in the network that your plan uses, but there are a variety of different medical providers that you can access for different needs. For minor medical conditions, your first choice for care is often the student health center at your campus. Under our plan, there's no copay or cost for you to use the campus health center. If you have questions regarding the student health center, you should connect with your school, but it's important to know that this service is available to you and should often be your first choice for care for minor medical conditions. If the student health center is closed, your next choice might be Teladoc. We'll talk more about Teladoc in a moment, but this is a free 24/7 service that's provided to you through your Luremark plan, where you can meet with a physician via phone or via video consultation for many minor medical conditions, such as sinus problems, allergy, or cold and flu symptoms. In some cases, they can even prescribe medication. For non-life-threatening but immediate care needs, like a fever or concerns about a sexually transmitted disease, strep throat, or minor injuries, you might consider visiting urgent care. Urgent care facilities are open late, sometimes 24 hours. You do not need an appointment and can just walk in and access medical care. Urgent care tends to be a really good option for students to utilize. You can also make an appointment with a doctor, which would mean you contact a doctor's office and schedule a time to meet with that doctor. This would be for non-urgent or perhaps more complex medical needs like an annual checkup, a specialist visit with a doctor like a dermatologist, cardiologist, or OBGYN. Often this is for non-immediate needs, as you may have to wait a few days or longer to schedule an appointment with that doctor. For severe medical conditions, such as loss of consciousness, severe pain or chest pain, major injuries, burns, severe bleeding, or broken bones, a hospital emergency room should be your choice for care. Or call 911 on your phone and an ambulance will pick you up and take you to the nearest hospital. It's important to note that in the United States, the hospital and hospital emergency room are generally not appropriate for minor medical conditions. The reason for that is because if you go to the hospital emergency room with a minor medical condition, such as allergies or sinus problems, you may wait a very long time because the doctors and nurses in the emergency room need to treat more severe patients first. So you could wait a very long time to access care at the emergency room, It's also more expensive for you to use. Navigating back to our page, let's talk more about the free services that are available to you through our plan. The first I just mentioned was Teledoc. If you click on our icon below here, you'll be able to access information regarding Teledoc. You can visit their website or download their app. Once you're enrolled into the Luremark plan, you'll be able to access Teledoc, where you can meet with a physician 24/7, as I mentioned, via web, via app, via phone, or via video conference, which is a great option for many minor medical conditions. We also provide virtual access to mental health care through a system called TELUS Health. If you click on Contact a Mental Health Counselor, it'll take you to our page for TELUS Health. Once logged in, there are a variety of resources that are available to you regarding health, living away from home, navigating relationships and student life, and you can view a variety of audio content, podcasts, assessments, articles, and more. Most importantly, if you need to speak with a mental health counselor, you can click Get Support, and you can call and chat with a counselor 24 hours a day, 7 days a week. You can also schedule a video appointment with a counselor, and the service is available in most languages. This is totally free to use and completely anonymous. Another service that's available to you is called Togetherall. Again, once you're enrolled into the Luremark program, you can access this service. And Togetherall is a completely anonymous, clinically monitored by licensed mental health professionals, peer-to-peer support network, where students can give support and get support from students who are having similar experiences that they might be having. There's various forums that you can participate in, as well as discussions and resources that you can access. Lastly, we'll talk about Scholastic Emergency Services. This is another service that's part of your plan. In the event you become very sick or critically injured, this is a service that would assist with transporting you back to your home country. If you're hospitalized, they can also transport a friend or family member here to the US to be with you. So it's important to share this contact information with your family back home. In the event of an emergency, they'll be able to access this service. Remember, with any questions or concerns that you might have, our team is available to help. You can reach us via phone, via email, or via chat during regular business hours. Thank you so much for your time, and we wish you the best of luck this semester at City College of San Francisco.